Good evening. My name is Jalen Bird. I'm in community health class at Florida State College of Jacksonville, and my project is on dialysis nurse. So let's begin with what is dialysis? So, dialysis is when they remove excess fluid and waste from the blood. So, this could be done either with hemodialysis, that's when your patient have IV port, or they do peritoneal dialysis when the actual um, dialysis site is located in the peritoneal cavity of the patient. So, peritoneal dialysis, this is a little bit more convenient. The patients can do this at home themselves, or a dialysis nurse can come do it. But hemodialysis, most likely your patients, they have to go to a site somewhere to get their dialysis done. So, with people with kidney failure, when their kidney function falls below 15%, or they show symptoms of fluid overload or electrolyte imbalance, your doctor may send you to a nephrologist, someone who studies the kidneys, and they may start you on dialysis. And they, depending on what works for you, you could get hemodialysis or peritoneal dialysis. So that's what dialysis is. So let's talk about the dialysis nurse now. So the dialysis nurse, they are nephrology specialization. So they are specialized in the kidneys. They're there to monitor your patients. They're there looking at the machine, the hemodialysis machine, making sure they're not pulling off too much fluid or putting in too much, going at a fast rate. They're there to educate your patients. They're there to tell them what's good, what's not good, the disadvantages and advantages of some procedures. So, and they're there to also support your patients with kidney failures who requires dialysis treatment. So the dialysis nurse, they talk with the actual nephrologist, and that's the physician, and they are also involved in the care plan. So sometimes dialysis nurse, they are in hospitals, they're in private practices, or they're in home care. So they're I wouldn't say everywhere, but they're more than just in the hospital. So let's talk about teaching and learning strategies. So with dialysis patients, dialysis nurse, it's very important that they're aware of their diet. With dialysis patients, the dialysis nurse should look at their potassium, the sodium, the fluid intake, and protein intake. Some of those are need to be either restricted or given more, just depending on the patient. Before dialysis, the dialysis nurse will look at the patient labs to monitor to see what's too much to pull off and what needs to be replaced. So the labs are important before getting dialysis. So the dialysis nurse, they look at those. Also, their vital signs. Make sure that the patient's not taking their blood pressure medication before they go to dialysis treatment, because sometimes you have hypotension or low blood pressure when you take your blood pressure medication, then go to dialysis, because you are removing fluid and you putting fluid back in. So the dialysis nurse, they monitor your blood pressure throughout the whole entire treatment. Um, they want to make sure you're getting the correct medication administration. Like I said, dialysis nurse, they look at your blood pressure, medication, make sure you're not taking them before your treatment. Also, some antibiotics, they recommend that you don't have, such as piperacillin. The water soluble vitamins, they recommend that the patient, they don't take those before dialysis. So your dialysis nurse will give you a rundown of what medications to take and what not to take before the treatment. Also, lastly, your dialysis nurse, they're going to monitor for signs and symptoms of infection. And especially with our peritoneal dialysis patients, sterilization is very, very important, because that dialysis site is right in the peritoneal cavity. So it's very important that that dialysis nurse monitor that site for any signs of infection, because that's not good. So moving on to how to become a dialysis nurse. Of course, you have to obtain your registered nurse license. So you have to go to nursing school and you have to pass your state boards and NCLEX exam. And you can attain a associate's or a bachelor's degree. But if you want to be a certified dialysis nurse, that is voluntary. You don't have to do it, but it is preferred in some facilities. So you go to the Nephrologist Nursing Certification Commission, and they actually distribute the exam. So for eligibility for the exam, you need to have at least 2,000 hours of experience caring for patients who require or who needs dialysis. With that being said, they also want you to have 20 hours of continuing education in nephrology nursing from the approved providers. An example of that is the American Nephrology Nurses Association. So those two things will have you eligible to take the test, and we take the test, and then you become a certified dialysis nurse. So moving on to the care team. So of course you're going to have your physician. The patient, they will have their primary doctor, and their primary doctor may refer them to a nephrologist. And your nephrologist, they are involved in the dialysis care. So they are involved in your kidney function, monitor your kidney function. They also monitor your blood pressure, medication, any other metabolic disorder. Also, who's working with the dialysis nurse is the dietitian, because those people help with the diet control. Remember, the sodium intake, the fluid intake, the potassium intake, and the protein intake, the calcium intake. It's so many things that that are in your food that sometimes dialysis patients, they just can't have because it'll mess with their labs, and then they'll put them in the fluid overload, and then so your dietitian and your dialysis nurse, they talk as well. Also, you have your social worker that's a part of the care team who's caring for a patient and talking to your dialysis nurse, and those people there are basically there to help cope the patient and the family adjust to dialysis or starting dialysis. So they're there for help, and the dialysis nurse, they will communicate with the social worker and tell them how they're coping with it. See if there is there anything different or anything that the patient can do differently to help with the situation. So they communicate as well. Also, excuse me, you have your dialysis technician. So they're there to help start the process. So they clean the machine down. They're there to answer any of the alarm systems. They're there to disconnect the machine, and they're also there to record the vital signs. So they work hand in hand with the dialysis nurse. So next is the skills and the abilities. So of course your dialysis nurse, she's going to be there to monitor your vital signs and monitor your labs. She's going to be there to make sure that the procedure is going good. You're not having any complications with your procedures, such as bleeding or infections. They're also there to communicate with the patients and the care team about the patient treatment. So they're also involved. So they will tell the doctor if they tolerated taking 1 liter or 2 liter off, or they need more fluid to come off, or we had to take more fluid off. So they're there to communicate that information with your care team. So moving on to some statistics that I found that was interesting. It was reported from the United States Renal Data System that 26 million Americans, adults, have kidney disease. That's a lot of people. And within those 26 million Americans, Black Americans are three and a half times more likely to experience kidney failure. Um, with that being said, kidney failure is the ninth leading cause of death in the United States. So, kidney disease kills more people than breast cancer or prostate cancer. Some people with kidney failure, they are on a waiting list for kidney transplant. But however, every day, at least 13 people die waiting for a kidney transplant, and that was reported from the Organ Transplantation Network. So moving along, let's talk about the salary. Um, so depending on your location and how much experience that you have, um, you can obtain up to $72,940 a year. That was recorded January 30th of 2017. However, here in Florida, the average salary is $60,000. So you're looking at between $27 to $42 an hour if you're a certified nephrology nurse. But however, if you are just your registered nurse, and you're working with a facility, then you will just get their standard pay. So yeah, that's the end of my presentation. These are my references, and thank you for watching.